Hello, everyone. Welcome back to the Beyond podcast. I'm your host, Dr. Flora. Like me, I know you all want your faces looking snatched, youthful, vibrant. There is just a lot of information out there, and it gets confusing. Like, I'm confused not only as a consumer, but even as a physician, a primary care physician with my patients bringing in a ton of products, information, side effects. There's a lot of information out there. So, my next guest is here to change all of that for us and give us all the fabulous tips and tricks to have our skins glowing. Hi, everyone. You are listening to Beyond, and I'm your host, Dr. Flora. Listen, life is hard. You don't have to do it alone. As a mindset coach, physician, mom, and an infertility warrior, I have mastered techniques to help move you towards contentment and growth. I can't wait to go along with this crazy-ass life journey with you while making sure you feel like your best self. This podcast is meant to have you feel unstuck from your rut and less alone. Let's do this. Dr. Tia Paul is a Harvard-trained, board-certified dermatologist in Orange County, California. She is the founder of her private practice, Balanced Skin Dermatology and Aesthetics in Orange County. Dr. Paul specializes in both adult and pediatric dermatology. Her clinical interests cover a pretty wide range from anything regarding general dermatology like acne, hyperpigmentation, eczema, skin cancer, and surgical and cosmetic dermatology, including Botox, chemical peels, microneedling, and lasers. Dr. Paul is also dedicated to patient education by delving into evidence-based medicine, especially for skin of color. Woohoo! She has published several articles in top medical journals and has also been featured in media publications like The Insider, Washington Post, HuffPost, Elle Magazine, and so much more. She serves on the advisory boards of several innovative skincare companies and startups, and she also works with multiple leading global skincare companies as their expert dermatologist. Dr. Paul is married, mom of 2 little humans and a fur baby. Please help me welcome this badass dermatology to the Beyond podcast. Tia, I am so excited to have you here.
Thank you so much. I'm equally excited to be here and talk about all things skin and skincare.
Awesome. So I love hearing myself, and I love having my listeners hear origin stories of my guests, because it really, I think, gives us a sense of understanding and a little bit of like an inside view of where you come from and what obstacles you have had to overcome to get to where you are. So I would love to know a little bit about your path, not only to the US, but a path into your dermatology career.
Yeah. So I was born and raised in India. So I moved to the US when I was 18-year-old for college. Ended up going to Cornell for undergrad. And then I knew it would be very hard to get into med school because I was an international student on a visa. So for 2 years, I worked at Mass General Hospital, just worked probably more than 80 hours a week. And probably that's where I focus a lot more on research too, and ended up getting into my dream school, which was Harvard Medical School. And then finally, after 4 years there, I was actually in a joint program between Harvard and MIT. And after 4 years
Wow.
there, decided to go into dermatology, even though that's another segue. I'll go into it about why my interest in dermatology. But I ended up going to University of Miami for dermatology. Again, it was probably very, very stressful at that time because I was still, again, an international student on a visa. And I didn't even realize a lot of state schools or even places like Stanford wouldn't even look at applications if you were an international student. So I had very limited option for derm residency, but it all worked out. I actually ended up going to my top choice, which was University of Miami. Did all of that. So it took 14 years to do all of that. And then finally I graduated, and it's been 5 years since I graduated, and I moved to Orange County. At first, I worked for a big hospital group because I had to. I was always on a visa. But after 17 years of being on a visa, I finally got my green card, when I felt very liberated, and then I could start my own practice. And hence, I just opened my practice less than 6 months ago.
Congratulations. I mean, what the path to medicine is already filled with so many sacrifices and a lot of years, right? But when you add a
Right.
whole different level of a work visa, being an international graduate, I don't think many realize the just not only hurdles, but just extra steps that you have to take to get into certain things that the most of us from here I take for granted, quite frankly.
Yeah, I think the biggest thing was the constant fear of, if the visa didn't go through, I would have to go back. And these are like, even
Yeah.
after going through all of med school, having that uncertainty and being like, at any given moment, if I don't get my visa, I'll have to go back. And another stressful scenario I'll share was, so for dermatology is probably one of the very competitive specialties to get into, and almost always everybody takes a year off during medical school to do research to get into derm.
Mhm.
I didn't really have that option because I had used up all my F1 work. You get only like 2 years where you're allowed to work. So with my visa, I didn't have the option to do an extra year when I was not really a student and working. So I didn't have that option. So I had to basically work extra hard and still publish, I don't know, 15, 16 journals or articles that I had
Jeez.
written while in med school, just because I didn't have that option. But it's okay. At that time I felt miserable. I used to cry a lot. But now, after going through that whole journey, I will definitely say it was all so, so worth it.
I'm sure it built a sense of tenacity and perseverance and sense of motivation, determination. I mean, all of those were stepping stones to opening up your own practice, which I know is not an easy feat. And I know we've had personal conversations about
No.
all of the random obstacles that come up. I mean, we don't learn how to build a business in medical school. This is not something that is like a class that's being taught to us. So a lot of this is self-taught. So I'm sure all of those prior hurdles really
Yeah.
played a role. Everything that you built in your self-growth and personality played a role when you're like, okay, it's time for me to open up my own practice. Let's do this. I'm sure that was also yet another rewarding challenge.
Yeah, no, absolutely. And I'm a firm believer in, if you don't try, you'll never know if it's going to work for you or not. And one thing I'm probably like very happy and proud of myself is, I am okay with uncertainty and leaving scenarios where you have to like trust yourself, have faith in your abilities and whatnot, but to take that risk. I'm okay doing that, because if you don't do it, you will never know what you're capable of. And man, it feels good to like then, succeed or aim or achieve whatever you were probably aiming for. But also with our personality, it's always then, okay, now what's next? So we also have to have
Yes.
that balance and train our mind to enjoy the moment till you plan the next move. But at the same time, you need to be okay walking away from scenarios, even if it's not the traditional path, and take that risk, because you never know what the reward is going to be. And the reward can be very, very sweet.
Where do you think that comes from? That personality trait of, hey, I am okay with risks? Because I know in most South Asian cultures, risk taking is something that we're not taught to do. We're taught to, stay in our safe zone, stay with our check boxes, the traditional sense. Where do you
Right.
think that comfort with uncertainty comes from? Is that from family? Is that from experience? Or is that just an inherent personality trait?
I think it's a combination of family and experiences in the past. So I grew up again in a very, very small town in India, like not even big cities. And my parents were, again, very okay with big changes. And so my brother was the very first person. So I have an older brother who's 12 years older than me, and he was the very first person in our entire town to come to the United States. And my
Wow.
parents were okay and comfortable letting him go, which now, as a parent of little ones, I am
I
so surprised. How can you let your kid go all the way to a whole different country? They had never been to the United States. They had no idea what it was going to be about. They barely had enough money, like all those stories you hear about, like moving to the country with $5. My brother probably had a little bit more than $5, but bare minimum. But my parents did
yeah.
whatever they could to help him move. And then 12 years later, when I expressed my interest to move there, and I don't know why and how, I knew I wanted to be a physician, even though we don't have any physician in the family. But I was always very set on it. I wanted to be a physician. And for some reason, I had this dream of becoming a physician from Harvard. So when I expressed that interest to my parents, they were okay letting this girl, where everybody in my community were like, you cannot let a girl go, boy is a whole different thing. But my mom and my dad, they fought with or they talked to their relatives, and they were okay letting me go on my own by myself. And I moved to a whole completely different coast of the United States. I was on the East Coast. My brother was the West Coast. And again, now I'm like, how did they send me to a whole different country by myself? Like, that's a lot of trust and all that. But they took those risks, for our betterment in the future and whatnot. And I'm so glad they did. And then the other experience that completely changed my life is my dad. I lost him when I was in medical school, and that's been 11
Mm.
years now. But when I lost him, it was also a very unexpected, loss. But I remember as a little girl, like I was 23 when I lost him, but all those years prior to that, he would always tell me, go for it, dream high, just go for it. You will never know till you try. And especially after I lost him, I think those are just those words that always, have stayed with me. And so anytime I'm making a big move, like I've walked away from very good jobs, but I did it because there was a voice at the back of my mind saying, do it. And I'm so glad I did it, because every move that I've made so far, I'm extremely, happy about, and have zero regrets. Yeah.
That's amazing. So sorry to hear about your dad, and I'm happy to hear that his words continue to help direct you in further progression in
Yeah.
your life. It's a special thing that he's left for you. Well, thank you for sharing that. Again, I think I love hearing these origin stories because it shapes who we are and where we are continuing to go. I think a lot of the times, especially over social media or even in real life, right, we get these like snapshots of each other.
Right.
Unless you're like physically going through someone else's shoes or living with
Right.
them, it's really tough to see, okay, these were the building blocks of Tia. This was the building
Right.
blocks for Flora. And so on the outside, we're like, oh, we got this really smart, hot, badass dermatologist opening up her practice and doing all the things when there were a lot of steps before you got to this point. So thank you for sharing that. That's a little bit of an inside look of what it takes to to get
Yeah.
to one of our goals, right? One of our many, many goals. Okay, let's talk all things skin because I know that's the primary reason that you're here. The skincare industry is booming, especially in the last 5 years. I remember, even before then, it was more about makeup. It was more about,
Right.
makeup trends, makeup techniques, YouTube, everything was just that's all we talked about. Now it's
Right.
more, I think the conversation has pivoted to skincare. How do we
Right.
take care of our skin underneath the makeup, underneath all the stuff that we do to it? Why now? What do you think happened in the last however many years where now we are the conversation has shifted to prevention?
Yeah, that's a very, very good point. And so, even in my clinic, when my patients come to talk to me, the number one thing that they say is, help me get to a point where I have to wear less makeup or maybe no makeup. I
Mhm.
want healthy skin. And I'm also very happy to hear a lot of time people are not necessarily chasing perfect skin, but because there is no such thing as perfect skin, but a healthy, well balanced skin. And I think a lot of this has to do also with like the whole pandemic, the last few years when people started going on social media a lot more. And on social media, this whole skincare just took off to a whole different level.
Mhm.
And then I'm also, I think like there's a lot of negative sides of social media, but some of the positive sides of social media too is like this whole mentality of like, yes, less is better, and let's do less makeup and focus on healthy skin and focus more on skincare and this whole concept of prevention. So like now everybody's into sunscreen, which 5 years ago, people were not wearing sunscreen at all. But now you ask
Mhm.
even the teenagers and they're very much into sunscreen, and not just sunscreen, other different skincare products too. Again, there are pros and cons, and I'm sure we'll talk about it, but at least there is this general awareness that if we take good care of our skin, we don't necessarily have to rely on makeup. And that's the ultimate goal.
You had mentioned, the downsides of social media. I'm not going to name any names, but there are plenty of celebrities out there now talking about the harm of sunscreen or behind sunscreen and um,
Sure.
parading the fact that they don't wear sunscreen. Um, I know my own thoughts. Tell me yours.
Right. Again, on social media, it's freedom of speech. Everybody is going to express their opinions. And then that's also when you rely on years of, data that we have and research
Yes.
that's been going on and the pros and benefit, right? Any decision or anything will have pros and cons, and you have to assess what outweighs the other. The benefits of sunscreen outweigh any possible harm from it. And so, yes, as a dermatologist, truly, 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 I will say this: if there is one thing you can do for your skin is to protect it from the sun. Number one, by wearing sunscreen, but number two, no sunscreen is 100% effective. So you still
Mhm.
have to stay away from super bright midday sun or wear, like a hat or seek shade.
Mhm.
But if you do that, that's going to help you so much for later on in your life. Because I spend a lot of time every single day staring at people's skin when they're in their 60s and 70s, and whether they're coming for skin checks and they have a bunch of these precancers and skin cancers, we're dealing with freezing them with liquid nitrogen or doing biopsies and whatnot. At that point, when I tell them, hey, you could have prevented a lot of this by wearing sunscreen, it's almost like a shock to them. They're like, but I don't go out in the sun right now. But it's not about the sun you're getting at that time. It's about the sun you got decades before
Yes.
that. So that's why sunscreen is more of a long-term investment into your skin. And if there is one thing you can do before spending thousands of dollars on other skincare or procedure, just please wear your sunscreen.
Simple. Simple. And it doesn't have to be expensive. It doesn't have to be, some fancy high-end brand. There are plenty of sunscreens that do its job that you can easily get
Yeah.
from local stores here. So I also love that your focus is skin of color because I have gone through my own fair share of estheticians and dermatologists back in the day that just weren't familiar with brown skin or melanated skin tones. How is treating or caring for melanated skin different from Caucasian skin tones?
Yeah. So treating melanated skin is very different from treating, Caucasian skin. And the other thing I realized throughout my medical school and medical journey thus far is there are a lot of dermatologists, not just, other physicians, but even dermatologists that are not comfortable in training or
Mhm.
in treating patients with skin of color. And why is that so? I mean, I went to really good schools like Harvard and whatnot. Even there, our exposure to treating skin of color might be limited because it depends on the patient population you're dealing with, right?
Right.
Boston is still diverse. We had some, but University of Miami, like Florida, that was way more diverse because we saw a lot of
Yeah.
people from Latin America. So it ends up like where you trained. If you train in places in the United States where you don't see that many patients with skin of color, you probably wouldn't have any exposure. And it's
Right.
sad to say this, but even our textbooks were very biased. Now finally we're starting to have textbooks in our dermatology literature that's focusing on skin of color, but we didn't have these for many, many years. So
Yeah.
that's the number one thing. Is even in terms of our education, there is this whole discrepancy, right? Second is the comfort. Why? Because in skin of color, first of all, things can present differently. Even if it's simple eczema, psoriasis, they just look different. And
Mhm.
so often there is a chance patients are misdiagnosed because they look different. They don't look like the classic textbook pictures. Second, it comes down to treatment or management. You have to be extremely treating patients with skin of color because you are at much higher rates of causing side effects. For example,
Mhm.
even if you're treating patients with lasers, for example, right? You're at a much higher risk of causing burns or hyperpigmentation. Even if you're treating them with a Kenalog shot, which is a cortisone shot, you're at a much higher risk of causing hypopigmentation,
Oh.
meaning
Mhm.
lack of color to the skin. Anything, even a simple thing like prescribing a tretinoin cream or retinoid for acne in skin of color, it might irritate their skin a whole lot more. And by that, they can then cause the hyperpigmentation. So my point is your skin can act very, very differently. And there's a very few people that specialize in that. But to me, I saw that as an opportunity, especially as someone who is of skin of color, and my friends, family, they're always, coming to me. So to me, that I saw
Yes.
that as an opportunity. And now my practice, a lot of it is focused on seeing patients of all different skin tone. And by again doing this every single day, 5 days a week for years, that's how we get comfortable in coming up with all different scenarios and handling them.
Is there more research now surrounding skin of color, even just for prevention?
Yes, it's coming. It's coming. It's slow, but I mean,
Yeah.
and I think a lot of that has to do with funding and a
Mhm.
lot of different things. It's interesting because even aside from the medical aspects of things, I work very closely with a lot of skincare companies, for example, and whether it's startups to leading brands, it's interesting to see even the trials. When we talk about clinical trials that these companies go through, sometimes they are not including patients with darker skin tone. Isn't that
Yeah.
so interesting? Yes, finally, there are a few brands that might be having a more diverse representation, but most brands don't. Most products are not tested on darker skin tone. Some change is happening, but it's nowhere as fast as we want to. And it's yeah, it's pretty shocking actually.
I think that's a consistency across a lot of things within the world of medicine, even preventative healthcare and primary care. We don't have, again, it's coming, but from when me and you went to school, we didn't
Correct.
have the data and education on women, skin of color, women of a certain age. So I'm
Right.
glad that, we as a medical community, and then that is going to be transferred into the consumerism portion of
Hmm.
this. Hopefully it'll transfer, so by the time our kids are grown, they will have more evidence-based and tested products on skin that looks like them.
Absolutely. No, it's coming. It's happening for sure. How
Yeah.
I felt about my skin color when I was 6 years old is very different from how my daughter, who's 6 years old, feels about her skin tone. She's very proud to be brown. But,
Yeah.
even growing up in India, I feel like I had mixed feelings. So things are changing and I'm very glad about that. But yeah, we're still in the process of that.
Yes, it will come. It will come, and I think it's also important to recognize that these trials take time. There's a
Right.
reason it takes time. The Whenever anything goes through a clinical trial, I mean, there's a multiple steps which can take years
Right.
to surpass whatever guidelines they need to surpass. So, what are top skin issues that you see in your practice within your South Asian patient population?
I would say number one is dark spots or hyperpigmentation, like
Yeah,
number one. Because I feel like, with our skin tone, we probably wrinkle less, but we hyperpigment very easily. Whether
yeah,
it's even from a simply getting an acne, my patients would be like, oh, that acne I know is going to go away in a week, but that dark spot is going to stay for months,
yep.
right? So, and it's not just from acne, even my patients coming in with eczema, they then will
Mhm.
have that dark patch that's going to last for a long time. And even some hyperpigmentation that's completely normal, that people, again, with people with darker skin get. But I think that's like the number one thing people come in for. Other than that, there's also common problems like acne. I would say acne is also pretty common, and then eczema. Those are top three conditions I see in clinic.
And what is something that a patient can do, and go to their local pharmacy to help with hyperpigmentation?
Number one, as we talked about, sunscreen, because the
Yay!
sun, the sun is not quite our friend. Even though growing up, we were told, go get your vitamin D from the sun or go lie down in the sun, you're gonna feel better. Honestly,
Yeah.
that like years later is gonna translate into, again, first of all, South Asians can also get skin cancer. But second, the
Mhm.
other very common thing about getting a lot of sun exposure throughout the years is later on you will get more and more brown spots. Because remember, there is a crazy delayed effect. It's not like the year I'm getting the sun, the same year I'm getting the hyperpigmentation. Yes, you can get the
Yeah.
sun the same year, but more so it's like, years later you will get that. And the just like core skin, the texture of your skin, and all of that. Like a lot of it is because of the sun. So for hyperpigmentation, I always say number one is sunscreen. It's your best friend. And again, no sunscreen is 100% protective, so you still have to try to avoid, going out to the beach during the peak hours of 10 a.m. to 4 p.m.
Yes.
Yeah, which a lot of us, my husband, he still doesn't care. He's still so much in the sun. And I'm like, we have sunscreen all over.
As a dermatologist, you're probably like, ah.
Yeah, but that's again a mindset thing. And I'm not saying it's
Mhm.
easy to change it because, yeah, I'm
Right.
struggling with it even at home. But at the same, or my in-laws, they're like, we never wore sunscreen our whole life. We're fine.
Yep.
And I'm
Yep.
like, but things could have been probably even more so different if you did.
Mhm.
But the awareness is coming. So number one, I would say sunscreen. Number two is figuring out the underlying cause of the hyperpigmentation. For example, I'll give this example. Even yesterday in clinic, I had a patient. She's been coming and getting treatments for her hyperpigmentation with prescription creams as well as combination with lasers. And we're seeing improvement, but she continues to have acne. So as she continues to have acne, she continues to
Mm,
get new brown spots. So for us, it's hard to keep up with it unless we get the actual acne under control. So I took a lot of time in clinic to focus and emphasize, no, now we need to shift from focusing more so on the hyperpigmentation to actually getting your acne under control, because otherwise
makes
it's like a
sense.
cycle. So same thing, whether it's bug bites causing the hyperpigmentation or whatever it might be, ingrown hair, then maybe consider getting laser hair removal, but solve
Yeah.
the underlying cause before you're targeting the hyperpigmentation.
Yeah, that's actually really important to recognize because even in primary care, I see patients who are like, "I want this treated." However, the prevention is just as important, right? You said sunscreen
Correct.
or treating the underlying cause, acne, sun protection, before we go in and spend hundreds and thousands of dollars for all the
Right.
cosmetic stuff, which is also helpful and wonderful. I do it myself, but
Right.
you're just going to be in this and never ending, cycle if you're not treating
Right.
the underlying cause. So that's a great call out. So let's go over some South Asian skin and hair myths. And I would
Okay.
love for you to add some if you have any more. But let's start with, you mentioned it, no sunscreen is needed because we have a natural skin barrier because of the color of our skin.
Yeah, so that's a very, very common one. Um, our skin, our melanin gives us a little protection, but it's not sufficient, right? It's not, and why, first of all, the question is, and a lot of my brown skin patients will ask me, why do I need sun protection? I might not get skin cancer. So that's why the number one thing is this is a myth that South Asians cannot get skin cancer. You can get skin cancer. And if anything, sometimes that type of skin cancer, like you could get a melanoma, which is more of a serious type of skin cancer. So if anything, even though your chances of getting a skin cancer is lower, the type of cancer you can get is probably a little bit more of a scarier type of skin cancer. And sometimes, the other thing that happens is the diagnosis is delayed because a lot of times
Mhm.
South Asians feel like, oh, that mole, I mean, it's fine. I'm not going to get skin cancer. That thing is fine. Like, it's not anything to worry about. But by delaying, like going to see your dermatologist or delaying the whole workup process, you might catch it as a stage where it's already, progressed a little bit. So that's number one, that you can still get skin cancer and hence it's important to wear sunscreen. Number two, like I said, even to prevent things like hyperpigmentation, which is a very common problem, or fine lines and wrinkles, the sun can do a lot of damage, or even simply coarse skin. So a good example I give is for people who drive a lot, right? Your
Mhm.
left side, because you're exposed to the sun when you're driving, can look different than the right side. And then there is this photo that goes viral over the internet of this truck driver who used to drive for years. I'm sure you probably have
I've
come
seen
across it.
it. Yeah.
Yeah, but he was his face. It was a classic example of yeah, someone like with more sun on the side that you're driving, like the skin just looked a lot more coarse, more wrinkly, more textured. And instead of spending thousands of dollars on procedures to change that, a simple thing like wearing sunscreen from a really early on age in your life can prevent or at least minimize a lot of that.
Absolutely. All right, myth number 2. Brown don't frown, meaning brown skin, we don't wrinkle as easy, yet we don't need any skincare because of the brown don't frown mentality.
Yeah, that's right. So, if you ask my mom's generation, if anything, they will emphasize this even a lot more. I mean, there
Yes.
is some element of truth to the fact that we wrinkle less compared to, somebody with lighter skin type, but we still do get fine lines. That's just a natural aging process. And look, first of all, I'll clarify, there is nothing wrong with aging, quote unquote, gracefully, but we can be
Correct.
graceful in whatever we choose to do, right?
I
Doing a
completely
little bit
agree.
of doing a little bit of Botox or laser is not does not make you less graceful. It's just about
Correct.
taking care of your skin. And that's just a very personal choice. If somebody doesn't want to do anything, I respect that. If somebody doesn't
Absolutely.
want to wear sunscreen at all, I'll probably talk to them, have a conversation with them. But at the end of the day, it's their decision, and I respect that,
Yes.
right? And
Yes.
same thing, if you choose to use or do any procedures that can help with some of the wrinkles, that's also totally fine. So it comes down to a personal choice and whatever makes you happy, right? But at the same time, yes, the older we get, the more years of experience we get, we definitely do get lines, whether it's fine lines or some of the deeper lines where skincare can help with fine lines, but some of the deeper
Yeah.
lines, you have to resort to things like botulinum toxin or lasers if you choose to do that.
Is it true that blue light, so all the exposure we get from all the tech that we have, so like right now, I literally have my computer screen, my laptop screen, my phone, all pointing to me, and I'm sitting, in front of a window for good lighting. Does that increase our risk of wrinkles, fine lines?
Okay, this one is a tricky one because there is some level of data, but then there is also, some level of like my personal opinion about this, right?
Okay,
So
let's hear it.
the data we have is that blue light, which is part of the visible spectrum of light, so it's different from, ultraviolet light, can
Hmm.
cause hyper or can worsen hyperpigmentation, especially in skin of color. So somebody with melasma or any
Hmm.
sort of brown spots, we know that the blue light can cause make it worse. Not necessarily
Interesting.
cause it, but make it worse, right? That's the data we have. Now, the data that is still kind of questionable is that the amount of blue light we are getting from all these devices, like the extent of the damage that is causing, that is still like we are not 100% sure about that. There is some early thinking of like, yeah, maybe like the blue light from all these devices are making our hyperpigmentation worse. Regardless, so my personal opinion is to be on the safe side. This is the reason why I say put on sunscreen on your face just the way you
Yep.
brush your teeth every day.
Hmm.
It is just a regular part of my routine in the morning. I brush my teeth. I go spend less than 2 minutes on my skin. I don't do 10-step skincare routine. Put on a good moisturizer. I put on my sunscreen, and I don't put on too much makeup, because I feel like, good about my skin. But anyway, so that's all I would do. But I do put on sunscreen even if I know I'm going to be indoor. Like today, I'm not planning to be out much, but I already have sunscreen on my face. So from that standpoint, I would say put on sunscreen when you're, especially if you're going to be around shields, screens and not. But am I going to say that if you're going to be in front of a screen, put on sunscreen multiple times throughout the day? In theory, maybe yes, but realistically, even I don't do that. Like, yes, in
Yeah.
theory, you're supposed to put on sunscreen every 2 hours. But I'll be honest, as a dermatologist, realistically, I don't do that. Yes, I will reapply sunscreen again when I'm going out in the sun, if I'm driving,
Hmm.
on my drive back home, I usually put on a compact powder. But
Oh, okay.
that's
That's good to
but
know.
yeah, that's like a quick 10-second thing, but some days I probably don't. But that's again things that are within reasons, right? So it's all about balance. That's why I like the word balance so much in my life.
And that's why your practice is named that too.
That's why.
But I love that sunscreen tip. I tell that to my own patients as well. Wear sunscreen daily, regardless. It does not matter because we don't have a terrible amount of confirming data about the blue light. Why wait? Right. And then
Right.
even if you, and we live in Southern California. So most of our days are sunny. So, yes, running errands, driving, picking up the kids, dropping off the kids, going
Yep.
out for errands, you still have sun exposure. Might as well have that sunscreen on hand, ready to go. And then the
Yep.
reapplication tip is great. Okay, last myth. It's about hair, which is
Uh-huh.
a pain point for so many of us South Asians.
Uh-huh.
But darker excess hair, body hair is what I'm referring to, cannot
Uh-huh.
be fixed.
Right. Right. Yeah. Hair, you can also talk about hair on the scalp because it's the other problem. I have a ton of patients coming in. They're like, my hair on my scalp is thinning, but I have too much hair on my body. So one thing it comes down to, again, first of all, understanding the cause of that, because sometimes there are medical causes of that. For example, PCOS, polycystic ovarian syndrome, you could have what we call hirsutism, which is excessive facial hair, for example. And sometimes I've had people, I actually diagnosed them with PCOS based on the hormonal acne I saw and
Mhm.
the amount of hair I saw on their face. And then I told them to go see their PCP or their gynecologist for further testing.
Yep.
But my point is, first, you have to really think of PCOS and make sure that that's not what's also making it worse. But after that, it comes down to body hair. So there's a couple things, right? So there are actually some medications too you could use that could help with body hair. Spironolactone is one of them for facial hair. And then number two is there is some other topical creams you can also use for body hair, but that's only to some extent. The most common thing is laser hair removal. And laser hair removal can be done safely as long as you can trust the place that you're going to. Because when you say the word laser, there are a ton of different types of lasers. You need to
Yes.
have the right and the safest laser for hair removal, which is typically a Nd:YAG 1064 nanometer wavelength laser. That's the one that's safest for hair removal, especially in skin of
Okay.
color.
So wait, did you just say a brand or did you just say a wavelength? I missed that.
Wavelength.
Wavelength. Okay. Can you repeat that just for people that are listening? What are they looking for from a laser for hair
It,
removal?
it's called Nd:YAG 1064. So
Okay.
N as in Nancy, D as in dog, YAG, YAG, Nd:YAG 1064. And that's the wavelength of light that some lasers will have, not necessarily the brand.
Okay. And I've had horrible experiences with laser hair removal because I went to the wrong practitioner who was using the wrong laser. They weren't using an Nd:YAG. And so, again, you do get what you pay for. A lot of
Right.
these quote unquote deals. I remember I was a resident I had no money. I was living in Southern California. I was paying
Right.
up the ass for a small rental here in the South Bay. And we
Yeah.
were making no money, but I wanted to take care of my dark thick hair that I didn't feel
Right.
comfortable walking around in shorts or in a
Sure.
bathing suit. And yeah, I got a Groupon deal, I'm embarrassed to say. And I was burned pretty badly and I had really bad hyperpigmentation. Then I started researching, learning, talking to more dermatologists and realizing there is a whole separate world for
Right.
skincare for melanated skin tones. And I didn't realize that. I mean, again, we just talked about how we didn't learn that in med school. And it was through
Sure.
experience, whether it's personal or with patients, where we do need to kind of be aware of, who we are going to and their experience. So for patients with darker skin tones who are looking for an esthetician, a dermatologist, what aspects of the practice should they be looking for? What are red flags that they should look for to say to themselves, ooh, maybe this is not the right match for me?
Yeah, I think like most things, right? Like you need to understand what's the demographic of the area and what's probably the patient population for that specific dermatologist, right? I'll probably speak more to a dermatologist than an esthetician, but like, yeah,
Mhm.
for me, it's like, who do I go to get my fillers done? It should be to a
Mhm.
dermatologist who does fillers on every single day basis versus going
Yep.
to someone who is doing fillers once a week or so. I don't do fillers, by the way, but I'm more of a laser person. But same thing. So if somebody's coming to me for fillers, I'll probably say, I'm not your person, right? So trying to like find that
Yeah.
right fit. And so when you go to see the doctor, ask them, and I'm sure most people or most physicians are going to be honest about it, right? So ask them, like, do you see a lot of patients with skin of color? Are you comfortable treating this? And I mean, not in a disrespectful way, but more so in a curious way, right? And I don't think there is
Yeah.
anything wrong or offensive in asking that question, right? And same thing
Absolutely.
goes with your technology, whether you're going in for lasers or microneedling or whatnot. Ask them the same question. Are your lasers compatible with treating skin of color? Like I wouldn't do a CO2 laser on skin of color, but some
Mhm.
places, maybe that's the only laser they have and they're happy to offer that, or an IPL. I would not do an
Mhm.
IPL on skin of color, but some place might just have that device and that's why they are, recommending it or offering that, right? But if that's the case, that's not a fit for you. Go to another doctor, do your research, and find a place that they have all these devices that are truly, safe on skin of color.
I'm going to just veer off here because I'm personally curious. You had mentioned that you don't do fillers. Fillers are all the hot topic everywhere that I turn to. Personally, why did you decide to stray away from fillers in your practice?
So this is a completely personal choice, and like I said, that's the beauty of what we do is we can make our own decisions, right? So
Mhm.
to me, I can achieve a lot of the results with lasers if you have the right technology. that people, going to get fillers. For example, even lips, now we have lasers, and I have the laser in my practice, for example,
Hmm.
that can plump up your lips in a very non-invasive, natural way because it stimulates collagen, and that's how it just helps up with the natural collagen loss we have over time. So it'll help up plump up that, versus putting in fillers, which, it's hyaluronic acid, but still technically a foreign body. Fillers
Yes.
can migrate. Some fillers are, yes, safe, but again, it's a personal choice. There's a lot of derms out there that do fillers. I have nothing against that. I'm happy to refer my patients to them. But personally, I feel like I can achieve a lot of those results that fillers would help you give, like whether it's, plumping up, putting a little bit of filler here to plump up your skin on the cheeks. You can get that sort of a 4D effect with other lasers, such as, one of the Photona 4D laser I have. So even though lasers are way more expensive, some lasers cost us more than $200,000, but I'd rather
Wow.
invest in those technology. Yeah, I mean, I lose sleep every time I buy one of these lasers, but anyway, but I'd rather
You
invest
guys,
in
it's a little
that.
bit of an inside look of a private practice owner here, but it's not easy. Okay, anyway,
It is not easy,
continue.
but I'd still much rather do that, and look at the long-term picture, because at the end of the day, when I go to sleep, I am very comfortable with the lasers I do on my patients. And I know, any chance of complication is very, very low compared to fillers where there are risk of complication. Even if you go to the world's best injector, things can
Hmm.
happen. It's just our
Absolutely.
anatomy, right?
Yep.
Bruising, a
Yep.
lot of it can happen. So from that standpoint, I prefer lasers a lot more than fillers.
What about another very common South Asian skin issue? What about under eye circles? I know there are multiple reasons for dark under eyes. Why don't you go through the top causes?
Okay, before I even go into that, I will tell you this. Treating dark circle is one of the hardest things to treat. It is
Yeah.
by far one of the hardest things to treat, and you need to have reasonable expectation. There's
Hmm.
a good chance it might not go away completely. We can improve the appearance of the dark
Yeah.
circles, but you need to have realistic expectation. So number one is what's causing it, right? Sometimes it could be just like a pigmentation issues, even with people who have allergies and they're
Hmm.
constantly rubbing their eyes, or if they have eczema around the eyes, that can then later heal with this hyperpigmentation, the post-inflammatory hyperpigmentation. So to treat that, you treat the underlying allergy, and sometimes even doing a little bit of an antihistamine, such as Zyrtec, or creams that will help that eczema under control. Can help with the dark circle or the hyperpigmentation. Number
Hmm.
two, this whole concept of lack of sleep. Yes, sure, lack of sleep can make it worse, but I mean, I have dark circles, and no matter how much sleep I get, I still have those
Hmm.
dark circles. So that's when it's more like, oh, is there a structural issue? So for me, for example, I got this from my dad, where my eyes are a little bit more sunken in. And
Hmm.
that's why, based on the anatomy around my eyes, I've had dark circles since I was a teenager. And that's like the one
Yeah.
area I actually do wear concealer no matter what, is
Yeah.
because even,
Same.
yeah, it's like I've given up. Like, I've tried every laser. It helps. Like, it definitely has improved over the years, but I'm still not completely comfortable not putting anything under the eye there, because not because what people would say, it's because I look more tired. And,
Yep.
it's like I just got 10 hours of sleep, but I'm still looking tired. And I've come to terms with it, and it's okay, right? It's completely okay with
Right.
that. So the structural part, that's the part that can be pretty kind of challenging to treat too. So those are common causes of hyperpigmentation. And in terms of how do you treat it, yes, eye creams help, but eye creams only help to some extent. Another
Hmm.
cause that I forgot to mention is, as we get older, our skin gets thin, right, over time, which is very normal. So sometimes there are these blood vessels underneath the eyes that become more visible because the skin is
Hmm.
thinning out, and that gives you that effect of dark circle as well. So number one, in terms of eye cream, there are some eye creams that can help stimulate collagen production. So like things, creams with retinol, for example, that's
Hmm.
good. Eye creams with hyaluronic acid helps hydrate the area. So if you have underlying, again, eczema like type of skin, then it can help to some extent. To some extent, eye creams with caffeine or vitamin C
Hmm.
can also help to some extent. But there is
Hmm.
no magical eye cream out there that's going to solve your problem of dark circles. So I'm
Yeah.
actually one of those people who keep telling my patients, don't spend too much money on eye cream. Like, you could get a over the counter version of eye cream. I don't even, in my office, I don't even recommend expensive eye creams to my patients, even though I carry skincare in my office. So that's number one. Number two comes down to I do believe in doing microneedling or laser to kind of again strengthen the skin around the eye. So you can do that by
Yeah.
stimulating collagen. So that works. Sometimes you can do microneedling and then also inject a little bit of PRP. So PRP is when you take
Mm-hmm.
your blood, spin it down, take the plasma, and that has all these growth factors. Same idea of stimulating growth and collagen in that area. And then finally, fillers can be an option for some people when they have that sort of a structural defect too, you know. But
Yeah.
again, you gotta be super, super careful when you're doing fillers in your under eye area. Not only the experience of the injector, but also these fillers can migrate, so they can
Yep.
move. And so it can sometimes, I always say go with very little amount, put in very little bit and see how you're doing versus adding too much, because that's when you can look different.
Yeah, absolutely. Those unwanted side effects are always possible, and even the best practitioners cannot
Right.
predict who is going to react a certain way. Thank you for breaking that down. I also personally have very dark under eyes, multitude of underlying issues, genetics, anatomy, allergies. Yes, I have great skincare. Yes, I have a fabulous concealer that I also do not walk out of the house without. All of it what helps. All right, Tia. So I am going to take you on a virtual, or not a virtual, sorry, a pretend trip to Sephora
Okay.
where we got all the Vegas lights, we got music, we got a shit ton of products with like beautiful pictures. What would you, let's go to top three, not even products, but what ingredients do you
hmm
recommend that we look for preventative skincare?
hmm Number one, sunscreen.
I knew it.
If there's one takeaway from this whole conversation is sunscreen. You could spend thousands of dollars on all these different skincare and procedures, but if you don't wear sunscreen, you're gonna take many steps backwards. So sunscreen, 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 and I always say this: the best sunscreen is the one you're actually going to wear.
Yes.
So you have to try out a whole different ones, see the texture, see how it feels on your skin, and then truly stick to it. Number two would still be a retinol or a retinoid because we have enough data or evidence showing that, a retinoid, especially this is something you wear only at night, so you use it only on
Mhm.
your skin at night. It helps with collagen stimulation, it helps with brown spots, it helps with this, again, natural, healthy aging of the skin. And believe it or not, like when I see again some of my patients in their 50s and 60s, whose skin looks really, really good, I often ask them, have you been using a retinoid your whole life? And yes, folks who've been using retinoid their whole life, you can tell. As a dermatologist, I can
Yeah.
tell based on looking at their skin in their 50s and 60s and whatnot. So that would be my number two. And
Okay.
number three, I would say is depending on your personal skin need, right? So if you
Mhm.
feel like your skin is very dry and very dull looking skin, I like niacinamide, for example.
Mhm.
Niacinamide can very gently even out your skin, but it's a very gentle ingredient compared to like vitamin C. A lot of people rave about vitamin C. Yes, but vitamin C helps brighten your skin, but sometimes it can also irritate your skin. So you really have to
Yeah.
see what your individual skin is like. So people who have very sensitive skin or who have underlying rosacea, for example, when they put on
Mhm.
vitamin C, their skin can get irritated. So maybe vitamin C is not the option for them. And it's good to go with other ingredients, say, for example, niacinamide. If you are more prone to hyperpigmentation, right, there's whole bunch of ingredients. So retinol and retinoids can help. Other than that, you have vitamin C, you have kojic acid, tranexamic acid,
Mhm.
glycolic acid. I know these sound so overwhelming, but my point is there is also unique formulations where they are combining these ingredients, and that way, it's safe, but yet hopefully effective to some extent. But just keep in mind, skincare can only help to some extent. So then there's that, and then I know you asked for three, but I'll give you a fourth one because the other very
Go
important thing
ahead.
is to hydrate your skin. So equally important is to use a moisturizer or hydrating ingredients that can help repair that skin barrier. Because we end up using all these active ingredients, retinols, vitamin C, blah, blah, blah. But if your skin barrier gets compromised, your skin is just going to be unhappy. So like focusing on moisturizers that have things like hyaluronic acid, ceramide, that is again helping your skin barrier feel, tight and repaired are equally important.
That was awesome. And I also I asked this this question in a very specific way because I wanted to call out the fact that marketing is marketing, right? So when you look at a product label, I've had so many patients come in with, reactions, skin
Correct.
sensitivity
Yeah.
reactions because they are overusing products or doubling up on ingredients without even knowing it because the outside label said skin brightening. The outside label said,
Correct.
get rid of your dark spots. The outside label said moisturizer, or hydrating when they were honestly doubling up on it and just stripping away their skin barrier. So really turn that package around and look at the ingredients. Dr. Paul just went through some major ingredients. So hyaluronic acid, niacinamide, retinol, retin-A, and what was the first? Sunscreen, obviously. And then last quick question, doesn't have to be a long answer, but strength of sunscreen is also something that I always hear random things about. Let's set the record straight for any skin tone, Caucasian, melanated skin tone, SPF strength, does it matter?
SPF 30 and above. Other than that, it really doesn't matter.
Awesome. Well, listeners, here you have it. Dr. Paul broke down everything so beautifully. Tia, thank you so much for taking the time to being on this podcast. We really appreciate your time and help and advice.
Thank you so much for having me, and please wear your sunscreen.
Tia, where can people find you on social media? If they want to see you as a patient, we'll post everything in the podcast page, but where can people find you?
Yeah, even on Instagram, you can just search Dr. Tia Paul, or on TikTok. I have a presence on TikTok. And then my practice is balanced skin dermatology and aesthetics. But I'm pretty sure if you just Google Dr. Tia Paul, it should come up.
Yes, and we will put links in our podcast page. All right, Beyond listeners, I want to hear from you. Dr. Tia Paul wants to hear from you. I want to hear feedback from this episode. If you have questions, DM me, email me. Y'all know my information. We will grab Dr. Tia's advice as well if I need her help on your questions, concerns, feedback. Thanks for being here. As always, I appreciate each and every one of your support. We'll see you next time. Bye.
Bye. Thank you.
Thank you so much for joining and spending your precious time here with me. As someone who prioritizes her energy, I am so grateful that you chose to spend yours here. To help me help you, please take an extra 30 seconds of your time to rate and review the podcast on your listening platform. For more tips and a behind-the-scenes look into my life, follow me on Instagram at Dr. Flora Sinha. That's Dr. Flora Sinha. Finally, connecting with you truly fills my cup. So DM me on Instagram, email me at florasinhamd@gmail.com, repost if you love this episode. I love hearing from you. I am so grateful for you and cannot wait to be back for the next episode. Bye.